these are my disclosures. We discussed, and Professor Fagerstrom has shown what has happened the previous years all over the globe, but in Europe as well. And you can see that we have lost about 175 million people because of smoking. And this is very much sad for the developing countries, but even more for developed countries. Now, what happens in Europe? You can see the prevalence of smoking in males is 38%, in female 19%, and in both sexes around 28%. And what happens with lung cancer risk? You can see at the very end that between 2000 and 2010, both male smokers and female smokers have a relative risk of about 20 times greater, 25 times greater than non-smokers. And of course, we know that there are short and long-term effects of smoking cessation. Within hours, the carbon monoxide levels fall. Within days, we have a better taste and smell. Within 1 or 2 months, the chronic bronchitis caused by smoking is improved. And if there is mild to moderate COPD, breathing is improved. Within 4 years, there is a substantial reduction in risk for cardiovascular disease and a 35% reduction for reinfarction in patients who already suffered from a heart attack. At 5 years, cervical cancer risk also falls to that of never smokers. At around 9 years, lung cancer risk reduction becomes apparent. And at 10 to 15 years, laryngeal cancer risk is also reduced to 60%, and lung cancer risk at 70% at 20 years. And at 20 years, actually, the non-smoker has an equivalent risk to a non-smoker. Now, what we have achieved all these years, you can see here what happened in the US. There was an exacerbation of the use of cigarettes in the early 50s. But then at this period here, the first data from epidemiologists came linking smoking to a worse health regarding cardiovascular events and cancer. And it was in 1964 that the first official report linked smoking, tobacco smoking, to deaths from cancer and heart disease. And in 1970, the US banned cigarette ads on radio and television. Now, you can see here the increasing rate of lung cancer reaching a peak of 55 to 100,000 men. Then the first measures were taken, taxation, information of the public health, expanding and giving information to the public about the lethal effects of smoking. And you can see here that there is a drop in the use of combustible smoking products in the conventional tobacco products, and a small but significant decrease in the rate of lung cancer death. And going back to 2010, still from 55 per 100,000 men to 30 per 100,000 men. Still, again, a high percentage of lung cancer, despite a reduction to a significant but not eliminating the number of cigarettes used per adult per day. You can see here it's about 15 cigarettes sold per adult per day. Now, what happened in USA also applied even in more countries that they have a better public health system, like Norway. Again, you can see here in Norway that there was an increase in deaths that was in parallel with the increase of the numbers of used cigarettes in Norway, though much lower than in USA, leading to, let's say, around 25 to 30 male lung cancers per 100,000. So no matter how we see it, when we have an increased number of cigarettes, we have an increase in lung cancer deaths. And when there are measures taken against the use of combustible cigarettes, then we get a fall in lung cancer deaths. This is another example here from Poland, where again, there were regulatory legislation regarding taxation of tobacco and regarding public information on the lethal effects. And you can see here the deaths and the number of cigarettes used. And you can see here that it may be effective in reducing the number of the use of the cigarettes down here. However, still in Poland, you get 100 cancers per 100,000 males. And a less, but again, significant number, 60 per 100,000 for UK, despite an important reduction of the use of tobacco smoking. Now, of course, we talk about lung cancer because 80% of lung cancers are related to smoking. However, we have mouth cancer, we have esophagus cancer, kidney, cervix, liver, bladder, pancreas, stomach, and acute myeloid leukemia. All of these are related to the use of smoking. And in any case, you can see that when we take measures, these are data from the cancer research in UK, when we take an act against the use of smoking cigarettes, then we have a decline, and this needs to be kept alive, because if we forget to do so, then there are some instances, like here around 90s, where not only we had a reduction, a decline, but we had an increase, particularly in the male population, of the use of smoke of cigarettes, of combustible cigarettes. That shows that we have to be in constant alert, in constant information, and constantly to adjust our policies, trying to reduce the number, of people, the number of smoking cigarettes, and trying to improve public health through smoking cessation. And this is again from UK, that they have very good data on that. And you can see here over the years that still there was a percentage of cancer, in 40% in women, 40 in women, 60 in men per 100,000. Still, there is a 20% of the adult population smoking, despite all the measures on taxation and information and bans on combustible tobacco cigarettes, and even using packets that show all the adverse effects of smoking on public health. So what about Europe's Beating Cancer Plan? It was introduced in February 2020, and it was a political commitment to leave no stone unturned in the fight against cancer. However, tobacco reduction, although already presented and introduced in countries like Sweden or UK, was neglected. And we know that still smoking contributes to be the leading cause of preventable cancer, with 27% of all cancers attributed to it. So that was our duty to motivate all the administrations interfering with the Europe's Beating Cancer Plan to start thinking about a harm reduction policy to further reduce the percentage of adults smoking. So the plan did not discuss at all about the e-cigarettes and the experience of UK, for example, in e-cigarettes, and of course the noble non-combustible products, although they appear to have lower risk of exposure to toxicants leading to cancer and cardiovascular diseases. Now, we know a lot of data, toxicological data, but also clinical data, that there is a reduced risk, and this will have a potential benefit to public health compared to conventional cigarettes. And of course, these are a promising alternative and harm reduction agents for smokers that fail or are unwilling to quit smoking. So we supported the plan's aim to prioritize protecting young people from smoking and protecting young people from the use of electronic cigarettes. But this is something that we have to see as an alternative for smokers to prevent the cancer, to prevent also cardiovascular disease. We also know that there are no conclusive evidence by large-scale trials or registries that the use of electronic cigarettes could lead to increased use and tobacco smoking rates in adolescents. And a recent registry from France supports this notion that does not, the use of electronic cigarettes is experimental only. It does not introduce young people to the use of tobacco, conventional tobacco products. The plan also proposes measures such as banning non-tobacco flavors for e-liquids. This, of course, makes these products, the use of flavored e-liquids, more attractive, for example, for a smoker to use it. But however, this may make it more attractive for adolescents. For this reason, and because there is a lot of uncertainty on that, we support the Europe's Beating Cancer Plan, and we believe that there should be a regulatory protection in the use of these products from adolescents to refrain distribution of flavored e-liquids to adolescents and make them strictly available to adult smokers. Now, Royal College of Physicians has a lot of tradition and has used and practiced the use of e-cigarettes in smoking cessation programs. They have shown and they believe that e-cigarettes are unlikely to exceed the 5% of the risk of smoking, and that should be an alternative for smokers who are unwilling to quit smoking. Also, in Netherlands, there is a registry showing that the heated tobacco products and its use has reduced exposure to harmful compounds to around 10 to 24 lower than using combustible products. Now, public health has embraced the harm reduction policy and has introduced vaping as a means to quit smoking and reduce the risk of cancer. Also, they have seen in smoking cessation, well-organized smoking cessation programs, well-organized smoking cessation clinics as well, that the use of a licensed medicine like NRTs or varenicline in combination with a vaping product facilitates the efficacy of these programs and achieves highest quit rates from the smokers, around 70%. And it is a reality that in real life, around 27% of people use a vaping product in an effort to quit, whereas 15% use NRTs, showing that pharmacological-driven smoking cessation programs are not very attractive for smokers. So I don't want to show more on that. Professor Fagerstrom has shown what happened to Sweden, that the rate has been fallen to 5%. That is the task provided by the European Union. And this has happened because there was a switch from the combustible tobacco products to snus. Also, the German Cancer Aid also supports that even if we increase taxes, if we increase awareness campaigns, then the 5% target posed by the European Union seems unlikely for Germany, where the starting point is 19% for men and 13% for women, and the mean is 25% for Europe. So what we believe in SCOHRE, we believe that the Commission's proposal should incorporate the experience of harm reduction policies from within, but also outside Europe, to improve the rates of smoking cessation and thus prohibit the lethal consequences of smoking. We believe that the uptake of harm reduction policies in Europe's Beating Cancer program is a new start and will contribute to healthier Europeans in future. Harm reduction should be considered as a third pillar for tobacco control, together with smoking cessation, smoking prevention, and affiliation with all the approved smoking cessation regimes. Thank you for your attention.